Hello, I'm Dr. Brian Prax, and today we're going to be covering how to test your nerves in the hands and also the feet. It's important to know with neuropathy that you have nerve damage. Or do you? That's what this test is going to evaluate. Do you have nerve damage? And if so, how bad is it? And from there, can we do anything about that nerve damage? And then, of course, what is it going to take? How much is it going to cost? We're going to be covering all of that in today's and the next appointment. So this testing is called the Toronto Clinical Scoring Evaluation. You can Google it if you want, but there's a lot of testing with the Toronto Clinical Scoring Evaluation, and this testing has shown really good examiner reliability. So the test is very reliable within 5 to 10%. So with common household tools, things like a butter knife, you're going to want to gather a cold pack. You're going to want to get something sharp. And we usually say get a paper clip, and we're going to open up that paper clip, and that's going to be used to test the sensation of sharpness. We're going to want to get something that produces heat. We usually use a blow dryer because most people have a blow dryer, but if you want to get a pack and put it in the microwave, we're not wanting to burn anybody's skin, but we want something hot. And then we're going to want something that vibrates. A common household piece of equipment would be like a common massager. You might have a toothbrush, a vibrating toothbrush. There's a number of different things. Maybe even the shop, I've had people use a Dremel, just something that vibrates to test those vibratory nerves. So speaking of which, we're going to be testing those small nerve fibers. We all have heard about the fibers, the large nerve fibers like the sciatic nerve, the median nerve, which ends up causing carpal tunnel syndrome if you have that. We're not testing those today. What we're testing are the small nerve fibers. These nerve fibers are teeny tiny, microscopic, and they branch out and they're going to feel your environment. So it's important to know that they don't just feel pain, they feel cold. Different nerves feel heat, a different nerve receptor feels vibration, another one feels pain, and then the last one is going to feel pressure. So we're going to want to make sure we test all of those nerves, see how they're working, how well they're working, and which ones aren't working. It's important to note that these nerves also work together. What's really fascinating is the vibration nerves and the pressure nerves turn down pain fibers. So if you follow that, that's why we like vibration massagers, because they actually feel good. And the way that works is they inhibit pain. What that means is they turn pain fibers down. Pressure nerves, like when you get a massage, that feels good because those pressure nerves also inhibit pain. So it's going to be really important to test each of those nerve fibers and see which of those are damaged, how bad they're damaged, because damage to the vibration nerves or the pressure nerves, if those are damaged, that means somebody's got the pedal to the metal on pain nerves, but there's no brake being applied to that. So we want to look at all of those. So make sure before we do the exam, you have all of your tools gathered, and here they are, ready to go. The next thing that's really, really important is we are needing to have an assistant with you. Because see, if I'm holding this cold pack or this butter knife, if I'm holding it, well, my brain is getting information from the right hand, and then it's trying to decipher what I'm feeling on the left side as well. It can be done, but this is much more ideal with a spouse, a significant other, an adult child, a neighbor, but it's going to be really important to have an assistant to help you with this, okay? The next thing we want to talk about when we test is we're always going to want to test the same area. And in science, we're going to call that the control. So everything is going to be tested compared to one spot. Generally speaking, it's going to be right here on this side of the elbow. We call that the antebrachium. We're almost always going to use the left side. Don't ask me why. That's just the way we always do it. if you have had damage to this left side here, then we may use the right side, or if your neuropathy is progressed all the way up to the elbow, then we may want to use the shoulder or maybe even a neck. But generally speaking, we're going to test the left elbow. So your assistant is going to start first by identifying which area is going to be your control. So it would look like this. Your assistant is going to grab the butter knife, and we're simply going to do a 1 second hold. This is really important that we test it exactly the same from the control to the hand and to the foot. By the way, yes, we are going to test the hands and we're going to test the feet. We're very thorough. You may be telling me, no, my neuropathy is only in my feet. Wonderful, but we're still going to test the hands. We don't want to leave any stone unturned. Okay, so we're going to test the hands, we're going to test the feet. We're going to do that every time. Why? Because although you may only be feeling it in your feet, neuropathy is progressive and it could be affecting your hands without you even knowing it. So I hope that makes sense. So your assistant's going to take the butter knife. And again, my assistant will help guide you through this. We're going to take a butter knife, a 1 second hold. I usually like to do this. 1001, 1001. Allison, does that feel about the same? Mm-hmm. And most of the time it will. So if it feels about the same, then we now know we can use the left elbow as our control. So follow along. The assistant will work with you and say, go ahead and test that, and she'll guide you through that. And what we're going to do for the Toronto testing is we're going to say, Allison, when I touch your elbow like that, we're going to call that a 10 level of coldness. Now, a 10 level means that should be the normal score that we're looking for. If you feel something less than a 10, meaning it's not as cold, it could be a 9, 8, 7, 5, 4, 3, 2, 1. If it's a 0, that means you feel no coldness down here compared to that. So it's important to know that the number of coldness could go higher. It could be an 11, a 12, it could go all the way to a 20 if it feels twice as cold, or all the way down to a 0 if you feel no cold. So let's get on into it. So I go like this. Allison, if this is a 10 level of coldness, what level of coldness would you say that is?
About a 4.
She says a 4 on that one. So I like to clarify my assistant with you as well. So a 4 means it's not even half as cold. It's a little bit less than half as cold as your elbow. Mm-hmm. All right. So we now have that established. My assistant will write down the 4. Then we're going to say, we're going to go test the top of the left foot. So I hope you saw that. We're always testing the top of the hand with a 1001 second hold there. And then we're going to do this one here. So I'm going to say, Allison, if this is a 10, what number of coldness is that?
About a 3.
All right, so even less than the hand. So I think you're starting to understand how that works. So then we go back. We're going to test the right side now, but we're going to use, again, the left elbow because that's the consistent one that we want to look at. Hope that makes sense. So I go back. Flipping the knife over because it begins to warm, we're going to go here. Allison, if that's a 10, what level of coldness is that?
About a 5.
And that's about a 5. So again, half as cold as that. Mm-hmm. And what level of coldness is that?
About a 3.
All right, so she says a 4 and a 5, a 3 and a 3. Okay, so that's the cool. The next one we're going to measure is pain, and pain is detected by our paper clip. What we're going to do here is we're going to take the sharp end of that, and we're going to do 3 little taps. It's important to know that the taps, the pressure that you put on the taps, when you do it here, should be the same here and the same there. Okay, so it'll look like this. 1, 2, 3, 1, 2, 3. So if that was a 10, what would you say your hand was?
About a 6.
So she says a 6 on that one. That's a little more than half. And Allison, what number is this? 1, 2, 3.
About a 5.
A 5. So again, half of what you felt here. Mm-hmm. So I will usually go back and retest the elbow. Now we're going to do the right side, but again, we're still using the left side. 1, 2, 3. 1, 2, 3. Right in the palm of the hand.
I would say about a 5.
She says a 5 on that one. And 1, 2, 3.
Between a 5 and a 6.
Okay, so she says between a 5 and a 6. So that might be a 5.5, but we're looking to have a number. A lot of times patients will say, that's not as cold. Well, we're not looking for that. We need to have numbers. So she said a 5 or a 6. We're usually trying to pick one or the other. So try and get just one number. Okay, the next one we're going to do is our cold pack. It should be nice and cold out of the freezer like ours. I like to bend it like this, and we're going to go right here again with a 1001, 1001. If that's a 10, what number of coldness is that?
That's about a 6.
She says a 6. And again, 1001, what number is that compared to your arm?
That's like above, like I would say like a 15.
So that's even higher. So a
Yeah.
15 means, that would mean that it's a lot colder here as compared to there, right? So I always want to confirm that with the patient so we're on the same scale. So that's a 15. Back to this, if that's a 10, what number is that?
About a 6.
6 on that one. And what number is that?
I would say the same as the left foot, about a 15.
All right. So we obviously have some trouble here with our patient. She's feeling way more cold down here as compared to the control. So I think you're starting to get the rhythm. You don't have to memorize how we're doing it because my assistant will go through all of this with you. The next one that we will do is going to be something hot. Now this one we need to be really careful with. This comes out really, really hot. And of course, the inner grill, this metal part, that could actually burn our patient. We don't want to do that. But on most of these, it's going to be a plastic shroud. So what we're going to do on this elbow is we're going to hold it not like this, because that will brand a patient, and we're not trying to do that. So it's going to be just touching down for 1 second. I promise you, if you do it on the plastic part right here, it will not scald the patient. So it's right here, 1001, 1001. So about a 45-degree angle. We're just trying to blow the air across. Okay? So I'm actually going to turn it on. We'll see how this feels with Allison. And we're going to go 1001. If that's a 10, what's that?
About a 2.
She says a 2, so it's not, so to clarify, that was 20% of the heat that you felt there. Now the foot, we're going to go right down here, and we're going to say, what number is that?
I would say about like a 0 to 1.
Okay, so she says a 0 to 1. That means she is hardly feeling any coldness. Now it's important to do that 1 second hold. Even though she's feeling nothing, she might want you to hold it longer, but that's not what we're doing. Exact test here, same amount of time, same angle, and all that is important for down there. Hope that's making sense. Also, if she feels it is 0, I don't have it on, but if I keep holding and holding and holding and holding and she just doesn't feel anything, I could actually burn her without even her knowing it. Well, that's bad. That's not what we're here for, okay? So now I'm going to go back and retest the left side, and then we'll compare it to the right. That's a 1001, so if that's a 10, what number is that?
I would say about a 2.
A 2 on that one. Turning it back on, and what number is that?
I would say about a 1.
So you really aren't feeling much down there at all. A little more on the right compared to the left. So we make sure we get our numbers accurate, right? Okay, the next one we're going to do is going to be light touch, also known as pressure. You already have the tool. It's one of these things, your finger, okay? So for light touch, you just drag it across the forearm here, and I say if that pressure is a 10, what's that?
About a 4.
She says a 4 on that one. And then we go across here. And what number is that?
0.
A 0. You don't feel that at all?
No.
Okay. And then again, back to a 10. And what number is that?
Between a 4 and a 5.
Between a 4 and a 5. And what number is that?
Between a 0 and 1.
Okay. The next one we're going to do is vibration. So that's going to be your vibration tool, whichever one you chose. The most important thing about vibration is if you have settings like I do, I've got 4 different settings on here. The question is, which setting do I put it on? Put it on the highest one, okay? Most importantly, however much pressure you use here needs to be the same as there. So if we have it on the highest setting at the initial exam and then at the 30-day and the 60, the 90, and future ones, if it's always set on the same setting, we're going to get accurate findings. So here I go. I'm going to put it on my highest setting, and we're going to test. Allison, hold your hands like this. I like to use the back side of the vibration. This seems to be overdoing it a bit. It's just overstimulating. So maybe the back side is the way I like to do it. We're going to go here for a 1-second hold. If that's a 10, the same pressure I put on the hand, what number is that?
About a 3.
About a 3. And then we're going to do the top of the foot. And what number is that?
The same, about a 3.
Okay. We're going to do the right side. So I'm going to, again, start with our control at the left. Again, Allison, that's a 10. And what number is that?
About a 4.
A 4. And what number is that?
Same as the left foot, about a 3.
Good. That concludes the testing for the Toronto Clinical Scoring Evaluation. We're going to make sure we gather the equipment. You now have a general idea of how this is going to work. Probably would be a good idea to show this to your assistant, and you don't have to worry about it. My assistant will guide you through everything. I'm looking forward to seeing you real soon.